Why should we choose you? Or what makes you so unique? Now, this is your chance. When you come across questions like that, this is your chance to deliver your personal marketing pitch. The admissions people, they're essentially asking the question, right? Okay, what are your strengths? And how do those strengths directly benefit you, and of course, as a future student in the program, and of course, future patients? Now, the key strategy here is to to synthesize your experiences into some unique areas so that you can point them out as USPs, unique selling points, if you like, of yourself, and how that then demonstrates that you will be an excellent student in their institution and also then become a superb future doctor or dentist. So, unique selling points, what would you look at? Well, in my opinion, look at 3 key areas, all right? First of all, what's unique about you? What distinguishes you from other highly qualified applicants? Now, this isn't about denigrating anybody. This is about you amplifying who you are. So you don't get into the game of saying, oh, I don't think they're any good or this or that. Don't get into that level of discussion. It's more about selling you, okay, well, look, I think everybody's great. But for me, this is what I think I can bring to the table. So what's unique about you? What distinguishes you? Secondly, what's relevant? So not everything you do, not everything you're great at will be relevant for this particular event, your interview. What relates to your medical life, your dental life, at school, and the future profession? What's relevant? And then the third thing would be substantiating it, supporting it by brief but very powerful examples, anecdotes if you like. Yeah, so evidencing it. I teach this to my students regularly at our courses. Yeah, evidence. So the first thing, which is about the USP around intellect, around perspective, the focus here should be what's distinct about your knowledge base, your perspective, your unique problem-solving skills. It doesn't have to be derived from, say, work experience in a GP surgery or at the hospital or at a dental practice. It can also come from other areas, such as, for example, working background, volunteering, jobs, life experience, research, visits, going abroad, doing charity work, etc., etc. It could be a whole host of backgrounds from which you can derive anecdotes and lessons from. Another area you might want to talk about is the hands USP, all right? Skills and action, if you like. So unique, relevant skills that would demonstrate, for example, manual dexterity, grit, determination, leadership, ability to have excellent empathy, right? You can highlight this in the most impactful way from anecdotes that come from volunteering, shadowing, research, community projects, involvement with family, business, and so forth. The other one would be look at heart, all right? Yeah, a bit cliche, but I call it the heart USP. What's your commitment? Are you a fit from a commitment perspective, from a culture perspective? Your passion, alignment with the university's mission, values, right? About contributing positively to society, to culture, being able to collaborate, being able to get involved in mentorship and advocacy, right? So you might look at it from a perspective of, the unwavering dedication to health equity, to looking at helping people from deprived backgrounds, to work with people from multiple backgrounds and so forth. It's a sense of, justice, a sense of equity that you want to apply to bring to medicine, to your practice as a future doctor, as a future dentist. So what I'm saying to you, in essence, is when you come to that table and you hear that question, you want to come across courteous, you want to come across professional. You don't want to be putting anyone else down, but at the same time, you're able to amplify and talk about what's so unique about you. And I said, one of those features are the head fit, i.e., what's unique about your knowledge levels, what's unique about your ability, your perspective in medicine and dentistry. The other one would be your hands. Your hands USP are your skills around doing things, the skills around managing things. What can you bring to the table that's potentially useful as a future doctor or a dentist? And also something about values that come from your heart, that connect with medicine, that connect with dentistry, and you want to bring that. And also, and in a positive way, it might be something that links well with the USP that the dental school, that the medical school brings to the table also. So it's a nice resonation of two sets of USPs coming together. So I hope this was useful in terms of bringing together you and your values and your strengths and weaknesses, but also matching it with that of the medical and dental school, and also then showing how that would be useful as a future doctor, as a future dentist.